beautiful friends. This is the Organizer Advisor, here to help you enhance your happiness and transform your life. Today is Tuesday, March 5th, in our marvelous, magical March of self-care. We are prioritizing self-care strategies and practices every day so that we could give good self-care to enhance our emotional and physical well-being. Let's talk a few minutes about what I call targeted self-care. Make sure that you check with your healthcare before changing any of your healthcare practices or before strategies, just to make sure they are aligned with your overall health goals. But talking about health goals, I want to focus on what I am using this month for, and that is to target my healthcare strategies, my self-care strategies towards some of my healthcare goals. And this would be a great time to make a list of what are your health goals. For me, I need to reduce my blood pressure, my blood glucose, my cholesterol, and I would like to drop a few pounds. I also want to maintain flexibility, and I also want to have good muscle tone, good cardiovascular health. So when I have all of these in mind, I'm going to strategically target the choices that I make in my self-care strategies to align with how I can achieve those goals. So we have generated this list of all of the resources that we have, that we've invested money in, or we've purchased, or we have on hand, so that we can capitalize on those resources to enhance our health and well-being. So from this list, I like to be able to choose different activities every day, variety to keep my motivation and enthusiasm up, but also to target specific goals. So going back to those goals, what do I need to do for cardiovascular health? What resources do I have? What do I want for flexibility? What resources do I have? What do I need for muscle tone? What resources do I have? So that way I can start to plan my pick threes, aligning with those goals and doing different things every day to make sure that I'm not getting your self-care and aligning it with your goals, using the resources that you have. Today, my pick three for exercise was I got on my big treadmill. And so today, I started out with an incline of 3 for 5 minutes. Then I went to 6 for 5 minutes. And then I went to an incline of 9 for 5 minutes. And then 12 for 5 minutes. That's as far as I was going to push it today. But that was 20 minutes of walking at 3 miles an hour on an incline. So that was a great workout for my cardiovascular health. Exercise-wise, you want to make sure that you're giving yourself variety, you're targeting your healthcare goals, and you're utilizing the things that you have on hand because you got them with the intention of enhancing your well-being. Now, the second pick three, number 2 on our pick 3 for today, it's mani-pedi day. I want to talk a little bit about the importance of mani-pedi. It's not just cosmetic. Your feet and your nail beds say a lot about your health and well-being. So Tuesdays are mani-pedi days for me. Remember, we created our mani-pedi bin box or basket, and this is the day I get out all of my mani-pedi resources. So today I used my little foot bath. I got this little foot bath device at Marshall's on clearance for $13. You know me, I cannot resist a bargain. But I like this because it has foot massage, it has a pumice stone so that we can keep those heels nice and soft. It has a vibration, so it will vibrate, so it gives like a little massage. I put a little Epsom salt, lavender scented, and then just for a little bit more essential oil and relaxation, a couple of sprigs of rosemary from my garden, and then I was able to soak my feet. And the nice thing about this one is it's collapsible for easy storage. So that was part of my mani-pedi routine. Right afterwards, while my feet were nice and soft, I made sure my heels were nice and soft. We're going to talk about that in a minute. Made sure that my toenails were at the appropriate length so that they're not uncomfortable and that there are no hang nails. Then after I soak my feet, dry them off really well with my soft towel, I use the same moisture barrier as I use with slugging at night. This is Aquaphor. I wipe it on my feet, and then I put on some really comfy socks and I let my feet just soften. Now, let's talk about feet health. Hang nails are going to disrupt your sleep. If you have a hang nail and it catches on your blankets or your sheets, it's going to disrupt your sleep, which will affect your health. Same thing with rough heels. If you have rough heels and you get into the bed and they snag and they creates friction on the sheets, that will disrupt your sleep as well. Also, cracked heels can be indicative of a vitamin deficiency, so you may want to check that out with your healthcare provider. Also, you want to look at your nail beds, both on your fingers and your toes, because if you see anything besides pink and healthy looking, that can be indicative of another underlying health issue that you want to investigate. I also want to talk about maintaining good foot care. Now, treat your feet because your feet support your entire body. I'll tell you a little story about my mom. My mom developed a bunion on her foot at one point, and she never got it treated. And then it turned into like arthritis, and her foot became really disfigured. And no matter how many times I urged her to go to a podiatrist, let's get the feet fixed, she resisted medical intervention, and it eventually affected her gait, which affected her hip, which affected her back, and then she was in a lot of pain. And it all started with the foot. And so toward the end of her life, she could only comfortably wear flip-flops. So just keep an eye on your feet. If you see anything that draws concern, please see your healthcare provider. Okay, so treat your feet, mani-pedi day, really taking time to take care of your feet and hands. It is summer coming up in the northern hemisphere. That's sandal season. So we want our feet to look beautiful, bright, soft, and just lovely as we transition from winter into spring. Let's talk about that's exercise, number one. Number two is our daily healthcare or beauty routine. Now let's talk about some of the things we want to do for our health. We also make sure that we hydrate. We take time for stillness, calm the body, the mind, reduce the cortisol, reduce the stress. That's going to lower blood pressure. And also, we want to make sure that we are eating aligned with our healthcare goals. Make conscious food choices. My goal is to lose a few pounds, so I want to make sure that I am eating to align with my goals so that all of my self-care routines and strategies dovetail into each other to provide enhanced overall health and well-being. Okay, so now those are our pick threes for today. I am again green tea, lower my blood sugar and raise my metabolism. And then there's some collagen in here. So cheers. If you are following our laundry strategies and cleaning strategies, I like to kind of scaffold it through the week. And so I have a laundry system. So if you are wearing certain colors every day, the color today is blues, greens, or violets. And those are colors that we can wash at the end of the day, because I know I'm not going to be wearing them again until next week, because I have a scaffolded color system so that I can do laundry either each day or every other day, wash it, dry it, fold it, iron it if it needs it, put it away, and then I'm done with that color for the week. No more piles of laundry. I like to just kind of keep it flowing and keep it going. And then lastly, same strategy with house caring or house cleaning. I do certain rooms every day so that my time off is unencumbered, and it is for me to cultivate joy doing things I absolutely love, not trying to catch up on housework and laundry. So today I clean my home office and guest bedroom. So light cleaning, end of the month is when we do the more serious cleaning. So focus your attention on those things today. That is it for me for our pick 3 and our marvelous, magical March of enhanced self-care and well-being. I'll see you tomorrow. Until then.